Manasa, one last question for you, and I think it's also very important. Is this integrated medicine only for treatment, or we can use it for prevention also?
I was waiting for this question, because this is my favorite. Because Ayurveda, the basic, we talk swastasya swatsya rakshanam and the field, and even at Prameya, I work mainly on the preventive part. So integration works well, not just for disease, it's fantastic for the prevention also. When it comes to I just love this fence model because we feel it works and fits into everything. So let's understand the preventive integration in this model itself. So when it comes to the physical health, regular vaccinations, the children, they get their vaccinations done. Particularly now we have seen post the chickenpox medicine, vaccination, how safe the children are. Particularly those who had the taste of shingles or the herpes, they only know the pain. So there is a vaccination to prevent that also. And they can incorporate yoga. They can do a master health checkup from the allopathic point of view. And they can incorporate strength training of physiotherapy, and they can incorporate dinacharya to maintain the routine. When we talk about dinacharya, it's the regime that is mentioned in Ayurveda to have a healthy life. And when it comes to emotional health, we can incorporate pranayama, we can use relaxation techniques, we can use art, music, and all the hobbies that we have, somewhere left behind, that can come into role. And when it comes to nutrition, we can integrate it such a way because you can have a personalized nutrition, because what works for you doesn't work for me. And the moderation, portion control, mindfulness of our other system of medicine, and the balanced diet of the modern nutrition can be incorporated beautifully. When it comes to the spiritual health, the Yama Niyama, which talks about how one should be externally and internally to have a beautiful life. And also there is a concept called Achara Rasayana in Ayurveda, which talks how you should behave, how you should talk, what should be your thought process, can be beautifully incorporated to prevent diseases. Because at Prameya, we always say, know your risk factor. Why we should know risk factor? So that we can work towards it and we don't end up in some disease. And also here, before concluding, I want to add something. When we talk about integration, when I said our alternative system of medicine or primary medicine, integrative medicine doesn't talk about superiority of any medicine. It talks about the advantage of all medicine. Because the day we wear that white coat, the day we took our oath, we are passionate about healing, and probably with the experience we have realized healer is somebody, we are just the mediator. So being the mediators of this healing process, we believe the patient safety, patient comes first. Because we, from the Bharata, we have a beautiful concept called Vasudhaiva Kutumbakam, and I feel almost all doctors think that, we pray for the one thing, Sarve Santu Niramaya, which means let all patients be disease-free. When we say they are disease-free, it's not just physically, it's mentally also. It's Samadosha, Samagni, Samadhatu, Prasanna Atma Mana. The contented soul also comes into the picture.
So fantastic. So beautifully put, Manasa. What a wonderful conclusion.